going to do a demonstration about how to tape an ankle. The purpose of this is to support the ankle post-injury, support chronically weak ankles, and to prevent inversion. So we're going to make sure that the ankle is clean and dry, no jewelry, and make sure there's no wounds. And if there's a wound, we're going to bandage it up for extra padding to reduce friction and continue taping. So I have my QDA or my pre-tape or quick drying adhesive, my heel and lace pads. We're going to place it where the laces go on the shoe and on the heel where it's going to create the most friction and blisters. I have my PowerFlex, which I'm going to use today as my pre-wrap. And I have my 1.5 inch white tape. So I'm going to first start by spraying the pre-tape. And I'm going to get all over the ankle. This is going to let the pre-wrap stick. And then, so I'm going to flick, make sure it's in dorsiflexion at 90 degrees. And this has some gooiness, so it'll stick. And I'm going to start with my pre-wrap, and it's going to be 6 inches above the ankle or right below the calf line or the belly of the muscle. I'm going to make sure I don't go past the 5th metatarsal head, which is located right there. But I want to tape above it before the tape doesn't stick. Next, I'm going to apply 2 anchor strips. 6 inches above the ankle or below the belly of the calf. And I'm going to do half the width tape for it's strong and doesn't open. And then I'm going to apply 1 strip at midfoot, proximal to the 5th metatarsal head. I'm going to make sure that it pulls up on the arch versus down to give a little bit of arch support. Make sure everything's smooth. I'm going to start off by applying 1 strip medial to lateral to prevent inversion, which is also known as a strip. I'm going to go from medial to lateral. And then I'm going to apply a horseshoe. And I'm going to go medial to lateral to prevent inversion again. Now I'm going to repeat this process 2 more times. And I'm going to fan them out as I go, but only 1/2 inch width. To make sure everything's smooth. Make sure I'm turning it away from her for I don't hurt her. Do 1 more horseshoe. Alright, now that I've done that 3 times, I'm going to do a heel lock full each one direction, or I would do 2 halves to create. I'm doing the full. And so I'm going to do another one on the other side. And I'm trying to get little wrinkles as possible. And I'm going to know that my heel locks are solid because there's going to be a triangle on each side. And so now I'm going to apply closer strips to secure all the loose ends. I'm going to start from distal to proximal. And I'm not going to go continuously around because it will create too much friction. And I'm going to go do one more to close the top. And I'm going to come down and I'm going to close up the bottom. And I'm going to be bringing up towards and bring up the arch. And those were my anchor strips. And I stayed right below the 5th metatarsal head. So I did this overall and I prevented the most wrinkles as I could. It's the appropriate tightness for when she plantar flex. It doesn't go too far down, but she still has some motion to dorsal flex. And then my appropriate tools to remove is I have a shark, or I have tape shears, or you can also use medic shears as long as they're medical, for they have the round tip. I like going medial side, but other people like going lateral. You can let them do it or whatnot, but I'm going to pull towards myself and come down along and make sure that I don't dig into them on their ankle, or I can come in on this side and go down. And that would be the same as the scissors, except most people don't like the scissors as much because it still kind of pokes. And I just want to make sure the blade is away from the patient and we're good.